everyone. On today's podcast, we're going to talk with Dr. Sara Ailshire and Dr. Siavash Samei about their preeclampsia birth story. Hi, everyone, and welcome to today's episode of the Evidence-Based Birth Podcast. Today, I am so excited to welcome two guests who are going to share their birth story and talk about preeclampsia and how they went through that experience. Dr. Sara Ailshire is a research team member here at Evidence-Based Birth, and she recently completed her PhD in anthropology. Dr. Ailshire's research focuses on birth professionals, including doulas, and reproductive rights in India. Dr. Siavash Samei is an Iranian environmental archaeologist who studies the relationship between climate, environment, and herding and foraging societies in the mountainous landscapes of West and South Asia from the Paleolithic to the present day. Sara and Siavash live in central Kentucky and are the proud parents of their daughter, Ferdous. Ferdous is 15 months old, loves her cat, and enjoys making her parents clap on command. Sara and Siavash, welcome to the Evidence-Based Birth Podcast.
Hi, we're happy to be here.
Thank you for having us.
Before we get into your birth story, I know that Ferdous was your rainbow baby, meaning you were pregnant with her after a prior pregnancy loss, Sara. I was wondering if we could start off by sharing a little bit about your experience with miscarriage and how that shaped your journey.
Sure, yeah. We got pregnant for the first time in March of 2023, and it was very exciting, and everything seemed to be going normally. We made our appointment. We found out pretty early on, I think about as early as you can find out of a home test. And, I was working at EBB, so pretty aware of birth stuff, but never really thought about having a miscarriage, that could be a risk or anything. So we went and we had a wonderful midwife where we used to live in Ohio, and we saw her and we were having an ultrasound done, and she left, she brought somebody else in, and yeah, it just turned out to be a miscarriage. So that was a bit of a shock.
Was that our first visit or second visit?
It was our first visit.
Our first visit.
Yeah. So it was like, the early, your first dating scan, I guess. So it was a big shock. And we thought, okay, I'll just see if the miscarriage would pass on its own, and it wouldn't. And where we lived in Ohio at the time, there's normally 2 medications you get to help you pass a miscarriage. And one of them was illegal because of anti-abortion legislation. So it was really difficult to get the other one where we lived. Like, you were at the pharmacy for a while. When we decided that, medical management might be best. We waited for about a week and nothing was happening. And I was ready for things to be over. It was pretty hard. But yeah, it was tough. It wasn't what we were expecting. And it was pretty sad.
I think what made it even sadder and harder for me, at least, was that when we went to the midwife, nurse midwife, and she was wonderful, is that they actually did the scanning at the end of the visit. So we had the entire visit where we talk about all manner of birth-related things, including our plans and did the tests and all this as if everything's going normally. And then at the end of the visit, that's when they did the scan.
Yeah.
And I'm like, well, if you'd done this at the beginning, maybe the pain would have been a little bit less. Just because, the anticipation had built up by the end of the visit. And then, I called the pharmacy. I didn't go yet. I called the pharmacy, and they put me on hold, and they had to talk to a manager. And then I think they had to call the nurse midwife's office to make sure that this was a legitimate, request. It took a while for them to approve the prescription.
Yeah.
And the day that she was passing, it was a very, very hard day. I mean, for both of us, certainly for you, unimaginable pain. But,
yeah, it was pretty uncomfortable.
Yeah.
And that was another thing too. I just didn't know very much about miscarriage, and you see it in TV. It's like, oh, there's blood, and you know what's happening. In this case, I had no insight into what was happening, and I also had no insight into how uncomfortable it could be to have a medically managed miscarriage. We waited for a week. We went back in because you had to be seen before you could, get the medication. We saw the midwife wasn't available. She was out of town. So we saw this doctor, and the doctor really didn't have maybe the same approach to care that the midwifery model has. So she wasn't very informative. And I think I remember asking her about, how it would be. And she's like, oh, it's fine. It's like a period. And it was not like a period at all. It was pretty painful.
You also asked for pain management medication.
Afterwards.
Afterwards,
Yeah.
and she had said just like Advil and over-the-counter Tylenol and Advil. And
yeah. Even though ACOG recommends that there's some type of, attention to the managing pain. I found out later. So yeah, after that, it was really eye-opening. It was really shocking. I knew of one person who had had a miscarriage, but like I'm pretty open talking about it. And what really sort of surprised me was that like so many other people started pouring out of the woodwork in my life who had like experienced miscarriage or experienced pregnancy loss. So it was hard, but I found that like when people were willing to share their stories with me, it made me feel a little bit better. And being able to talk about it too, like whatever that pregnancy was, even though, there's very little record of it, and, it still existed and it mattered. And like it carries forward when we can talk about it. Yeah.
Because it was a very lonely experience.
Yeah.
I mean, we had friends in Ohio, but none that either didn't have children, or if they had children, we were not that close with them.
Yeah.
And so from the very beginning until the moment it was done, it was a very lonely experience. And in an apartment complex in the rural northeastern Ohio, I mean, so to have these stories come out and for people to share their own stories with us was quite, I think, made us feel like there's a whole big community of people out there that have gone through the same thing.
Yeah.
Or something similar to our experience.
And I remember thinking at the time, like you said, you were working at EBB back then as well. You were dealing with the loss itself, which was extremely sad. And like you said, lonely and all of these feelings, but then the difficulty with getting care just threw another like insult onto injury. And this was about 10 months after Roe v. Wade was overturned. And you were already, as someone who was having a miscarriage, experiencing the impact of that.
Yeah, absolutely. I mean, I remember thinking, I was like, could I even go and get a DNC? Like, what would that look like in this area? And it never occurred to me. Again, it's just those things that you don't think about. Like, you think oftentimes about access to abortion as being like you have a pregnancy and you do not want to be pregnant. And I very much wanted to be pregnant, but wasn't anymore, but was. And in order to have a pregnancy,
you were in limbo.
I was in limbo. Like, in order to move forward and maybe try to conceive again, like, we had to complete this miscarriage. And it was very frustrating. I
couldn't get the best medication option. No. You had to use the second best option.
Exactly. And we talked to the physician about it, and she was talking about how there was a way. It was very difficult. It was possible, but it was very, very, oppressively difficult to get licensed to prescribe this medication. Like, in the burden
in the entire state, there were like maybe 3 or 4 licensed prescribers of that second medication.
Yeah. And that's the thing, access, it's like a reproductive justice issue, right? It doesn't just affect people who don't want to be pregnant, it affects people who do. Like, access to abortion affects people who maybe would never choose to have an abortion, but get pregnant and have a miscarriage. Like, these things are so interconnected, and it really surprised me.
Now I think about this, having this conversation is, think about when you had the birth. When Ferdous was born, it was all hands on deck. Everybody was there. In fact, we had to keep people out of the room, like our parents, our mothers, and, it was very much a community-oriented process. With miscarriage, it was the exact opposite. Yeah. It was, even though you were giving, in many ways, it's more difficult than a birth because the body is not naturally ejected.
Oh, because you had to take the medication.
It's an entirely lonesome process. And almost either we shun ourselves or somehow people are just like, I don't want anything to do with you. You just do this at home on your own. It becomes very taboo.
Yeah.
In a way that it would have been a lot easier if we had people there to help.
Yeah.
Maybe you have, I don't know.
No, I think it's a point well taken. Yeah.
Were there any resources, Sara, that you found that helped you through the process, like with managing comfort, since the physician didn't give you any help with that?
Honestly, I just had to kind of wait it out. I didn't even think to ask about pain management prior. It was afterwards I was experiencing some pelvic dysfunction, and I think I just kind of rested and like lived on top of a hot water bottle for a while. I took a lot of
Advil.
Yeah, just trying to find different body postures and ways to be comfortable and just taking it easy, resting. It was so humbling being so involved with birth work and doing research for EBB and realizing just how much I didn't know about pregnancy loss. And what a education. But yeah.
Yeah, well, we'll make sure in the show notes to put some links to a few articles I remember we found when you were going through that about managing comfort. Because I think you're right. It's just not discussed enough. It's like, here, take this pill. This will terminate or complete the miscarriage.
Yeah, you'll finish and you can get back to normal. And yeah. Yeah.
There's other things that can be helpful.
No, exactly. Yeah.
And what was the medication you ended up taking then?
It was misoprostol.
Okay.
Yeah, or I guess Cytotec. Yeah.
Which is still available, although that has been proposed to be limited in some places as well.
Yeah.
So, yeah. So how did that, shape then your next pregnancy? Tell us about that pregnancy journey.
I was practicing a lot of detachment for a while. We didn't tell anybody. We were pregnant the first time. I think I told my mom almost straight away, very soon after. And we didn't tell anybody, I think, until 12 weeks?
Yeah, I mean, the first time we shared with some loved ones, and hindsight was not a very good idea because in addition to having to manage our own emotional sort of, pain, we also had to provide care for the emotional pain of our loved ones. So this time, I think we definitely did not tell anybody until we passed the 12-week.
Yeah, there's a miscarriage calculator that I was obsessed with, and every day, you can plug it in and check your numbers, and I would fiddle around with it. I'm 5'3.5", so sometimes I was just constantly fiddle. I'm 5'3" and 5'4", just all of these things, just to kind of see what the odds are, which is weird because I'm very much not a quant person and I'm kind of suspicious of quantification. I was trying to quantify everything, but I was what percent, what's my risk today? So that was part of it. Detachment. It took a while, I think, to kind of accept that this was really going to happen.
Yeah. I don't remember much, but if I recall correctly, I think, speaking for myself, but even you were very anxious.
Yeah.
Up until I think the second or third visit, very anxious. Because, until the ultrasound essentially cranks up, and whether you hear your heartbeat or not, I mean, it's like a children's box. You don't know whether the fetus has a heartbeat or not.
We would not look at the screen. I don't think I felt okay until I could feel movement. And even then I was very focused on counting the kicks, and if she wasn't moving, I'd be drinking. I'm not a juice person. I was drinking juice. I was doing things wake up. But I felt bad because she was probably just resting. And I was hello, are you good? I mean, yeah, definitely cast a bit of a pall over the pregnancy. And I'm not saying I wasn't happy. I was so happy and wonderful, but you are very aware of what can go wrong. So definitely, I think that was in the front of our mind until well into the third trimester, basically. So
yeah. And during that time, you moved to Kentucky and you started making plans for the birth. So tell us how that process went.
Oh, wow. So I had a good friend in the area, and she recommended a provider in Lexington. And I went, and again, I have nothing but wonderful things to say about the midwifery care we had there. They were wonderful. But at our second visit, we were talking to our midwife, and we were just asking her, because we would have given birth at Central Baptist Hospital, I think was where they deliver, or where people give birth with them. And I was asking her about the C-section rate. And then she was I think very highly of her, but she was yeah, it's about it's pretty high, it's 30-40%. And I was oh. So, and also that was where we went and did a lot of labs. So, you do your first round of blood testing, all of those things. We did our Natera, so we were with her. She told us about the high cesarean rate at Central Baptist. We went and we were doing all of our blood testing there. And it was chaos. We were kind of it was a sea of people. And it was very difficult to fill that. And we just thought, maybe this isn't the practice for us. And we were about 16 weeks pregnant at that point.
And that's the busiest labor and delivery unit in the central Kentucky area.
Wow. So I was looking at EBB because EBB has some information for people in Kentucky about different hospitals and their primary C-section rates. And we live fairly close to Stanford, which has Fort Logan. And they had a very favorable, I think something 20%, 19%. It was low primary C-section rate. And we decided, okay, well, why don't we check this out? So we started going and we saw our midwife, Jamie, who was just wonderful. And it was just nothing negative about the other midwives we saw. They were great. They were giving wonderful care, but I think in a system that wasn't super conducive to the midwifery model. Whereas where we went, it was, a mixed practice of doctors and midwives, but it was very much focused on midwifery model of care.
The OBs in many ways have paid deference to the midwifery model.
So
they have a strong family medicine practice. And we're talking about Stanford in Kentucky, not Stanford in California.
Very different standard.
Yeah. A tiny town. But
galaxies apart,
Yeah, but with a well-regarded small labor and delivery unit run mostly by family physicians and midwives.
Yeah.
Correct.
No, exactly.
Who I think are like local. Who live in the area or
and local to
area.
You.
Yeah.
So, yeah, it was great. She was very holistic. Like, I'm not a chiropractor person, but she recommended a chiropractor if I was interested. You know, she was very supportive of doulas. She had a list of doulas that she offered to us, not that worked with the hospital or worked with her, but just that she had encountered in her practice. And it was great. We had a wonderful quality of care there. And she made a lot of time for us. I mean, we're nervous, chatty academics. We talk a lot.
A lot of questions.
Lots of questions.
Yeah, it's your first baby, too.
Some questions can run into the esoteric or the abstract.
Yeah.
They made a lot of time.
Everybody there is great. So we were really happy that we switched. It was scary to switch.
It sounds like you got really personalized care during your pregnancy there.
Absolutely.
Yeah.
Absolutely.
And what were your hopes and plans for the birth itself?
From my research and from working at EBB, I'm very much a believer that there's lots of ways to have a baby that are great. It's just sort of more like making sure a person's like needs are met, that their autonomy is respected. So I really wanted to have a low intervention birth, as low as possible. But I, again, like was open to, basically like being flexible as things change. So, I didn't want to get super invested in like, it has to be this way, because I think birth's like an evolving process. And like, I had that knowledge from working at EBB and from my research. So I was very interested in having a low intervention hospital birth. I just thought, there is home birth care in our area. So when we thought about it, but I thought, just because it's my first time, I'm not sure. Why don't we try? We found a hospital that seems to have, a pretty low intervention approach for a hospital. And we had a great midwife who we knew, like, that was also her, like, approach to pregnancy care. And we hired eventually a doula who we thought could help us. So we thought, okay, like, we'll do that.
I think we hired a doula is a bit of a stretch.
You hired a doula.
That's a different story.
But
I think I always took my cue from her. She wanted a low intervention birth. So, and she, in a very academic and sense, she knows what she wants and she's done her research. Although, as I think she would probably say, when it's crunch time, the academic knowledge somehow just goes out the door for many years. And so I took my cues from her. I knew there was like a birth center in Indiana, but it was too far for us. In an ideal world where we had the funds and the money and the energy and the resources, I would have loved for her to give birth in India, and one of the many birth centers or birth villages that she has done research in. But I mean, logistically it was impossible, but also the fact that legally it was also very challenging. So I think this was in many ways the best compromise. A place that was a hospital that had all the biomedical facilities that we needed, all the while that one also followed the midwifery model and low intervention model that Sara wanted. So it was perfect.
Yeah, it really did seem like the golden ticket.
We're actually very anxious to what happens to that facility now, because with the new bill and the cuts to Medicaid, a place like that gets a lot of its funding from Medicaid might be hurt tremendously.
Yeah, its status is in question.
Yeah,
as a possible birthing location in the future, even though it's been serving families in that area for many, many years.
Yeah, I mean, it's only 6 beds on the ward, but it was a full house when we were there, so yeah, it was great. I mean, again, hospitals on a birth center, there's, we make that distinction, but I think as much as you can have that ethos in a hospital setting, like, that was their approach.
Mm-hmm.
Yeah.
So you're planning to give birth there, and you had a doula, and you educated yourself. I know, Sara, you already had some education, but Siavash, like, how did you learn about birth then?
I would say that for somebody who I think likes to read and educate himself, and being married to somebody who, again, knows this stuff quite well, obviously compared to the average person who's going to have kids, I was not as ready as I should have. I mean, Sara had bought books and shared resources with me. Toward the end, as it became more and more real, I definitely began reading a bit. I also had a whole world of my own going on at the same time, just a new job and, basically 5 new courses to teach from scratch, to develop, design, and implement from scratch, new colleagues, new everything, and this is a job where I want to keep this job. Every day for me at work was basically just keeping my head above the water, just keeping myself afloat one wave at a time. And so it was really hard for me to balance those two. But as it became more and more real, I began reading a bit. But I thought at this point, for a number of reasons, including for my own sake and for her sake, we thought that we should hire a doula.
I was going to say, it sounds like the doula was a necessity in your situation then. Yeah.
Mm-hmm.
Yeah, like a match made in heaven. It couldn't have turned out better. And then, we took the hospital birth class because it was free, and I know we had lots of birth classes available to us. Yeah,
and it was not good.
Yes, it was not good.
And then we took. It
Sorry,
was not good.
No offense to the instructor, but
no, it was not. I don't think they designed the curriculum. Maybe
it was not their curriculum. Yeah,
good. Sitting in a class with a smart kid where she's like, "That's not right. That's not right." And I'm taking notes, obviously vociferously, but also even I knew like this should be a bit more hands-on than it is. Like it should be a bit more hands-on. And then we took the birth class run by
a friend of mine,
a friend of yours in India, and we took the class virtually, and that was even though it was virtual, it was wonderful.
It was much better. And we also had access to some of the EBV birth courses too, so we were able to kind of pick and choose some of those videos. We didn't go through the whole thing because time was winding down, but it was really nice to have.
I was primarily stressing for a doula for a number of reasons, but one of my anxieties was that we're giving birth in a very rural part of the country. I was not sure about my ability to advocate for her if something goes wrong, if she needs advocacy for whatever reason, simply because of the color of my skin, of where I come from, of my name. I'm of Middle Eastern descent, of Muslim background, and I wasn't sure if I would be believed. If she needs somebody to be an advocate for her, whether I could do it justice.
Yeah.
And again, the labor process itself, I knew was a lonely process. I mean, it's lonely for her because she's the one doing it, but I'm supposed to be there to provide care. If I am not confident in my own ability as a supporting partner to do that, then we need a third person. I mean, financially, we were not in a place to hire a doula. And so my colleagues, our friends here, put together a little baby shower for us and actually collected funds to help us hire a doula. And we interviewed a couple of people and finally, settled. And that was the best choice we ever made, I think.
That's amazing.
After picking Stanford, I think it was the best choice we ever made.
I think we'll get more into that advocacy part and some of the discrimination later in your story. But Sara, when did you first realize something might not be going as expected in your pregnancy as you got towards the end of pregnancy?
I think around maybe the 30-week mark or so, we would gone in for just a regular appointment that you do. And I think I had a little bit of elevated protein in my urine, not a lot. I was in the normal range, but that was the first time I ever heard that comment made. And then, at the following appointment I went in, it was a little bit higher. And then at the 36-week appointment, we went in and they were like, okay, this is high, but I had no other symptoms, no blood pressure symptoms, anything like that. They sent me home with a big jug of pee in. And I set up, you have to keep it cool. So you have to set up this whole apparatus. Again, they don't give you a lot of instructions because I picked it up. It wasn't handed to me in an appointment. I just collected it. And lots of good resources on the internet about how to keep your urine collection drug cool. So, I did that for the 24 hours, sent it back in. And then at the following appointment, about 37 weeks, they were like, okay, you probably have preeclampsia. You need to be taking your blood pressure. I think that was the first time I ever had an elevated blood pressure reading was at that appointment too. I was always in the 110s, 100s, lower. I've always had kind of lower blood pressure. And that was the first time I had ever spiked, I think 120 something.
I don't remember, but it was high.
It was high. It was high for me too, which I think was more important. They were like, this is not usual. So they said, why don't you get a blood pressure monitor and monitor yourself at home? I think a 36-week appointment. That's when I had that first bit of a higher blood pressure. Yeah.
It was March, yeah.
So we got it out, and I think this is after we had returned the jug for testing. And I think we put it on, and it kept saying 140, 145. I'm like, oh, this is wrong.
Yeah, I bought this hard.
You bought one at Kroger or something.
Kroger,
yeah. It's malfunctioning.
It's malfunctioning. And I was obviously, I'm silly. I don't know how to use
this. Because you felt well. You felt fine.
I felt totally normal. I felt A-okay. So we're like, oh, whatever. And then I was like, okay. I watched, I went online and made sure I knew I was using it correctly and did everything you're supposed to do, I think I sat for a while and I got it on my arm the right way and got a little table out so I could put it on the table correctly. I was I'm going to do this as to the book as possible. And it was still reading high. And it's this is broken.
It's 140 over something.
I was 140 over something. I was this is not real. So But I was starting to worry. I was like, okay, like maybe something's going on. Like we should just make sure we're getting this done correctly. And I think in retrospect, it's like really ridiculous. I'm like, obviously I had high blood pressure, but
well, I mean, we've all had instances where the blood pressure cuff, maybe isn't working.
Usually high blood pressure also comes with other symptoms, and she had no other symptoms. She felt
it's like your numbers were starting to show there was something before you were starting to have any physical symptoms.
Yeah.
No, which means you're catching it early, hopefully.
Yeah, no, absolutely. I think, they were very much keeping an eye on things, and like the moment, and I think there's a degree of range that can be normal. So, but like the moment that like there's this real clear trend developing, they're like, okay, let's just test and make sure you're good. And my mother had preeclampsia, so I knew that could be a risk factor. If she had it, I might be likely to have it. So we went to a CVS. There's a CVS close to our home. And we went to the blood pressure machine there because I'm just like, this is probably calibrated to be like fairly user friendly. I'm not saying it's like super accurate, but I'm like, this is probably, if there's something wrong with our home machine, this one might be better. Let's just try it and see what it says. If two machines say it's high, then, then it's not user error. And I think at that one,
do you remember what it was?
It was like, you tell it.
It was 177.
It was like 177.
Oh no.
And we'd walk there, and I felt fine. I didn't have a head. I felt totally okay. And then we go back home. I'm like, we have to go to the hospital. Like, that's really high. Like, we have to go to labor and delivery and like get checked out.
Which, luckily for us, is right across the street from CVS. I mean, from our house to CVS to the hospital is like a 3-4 minute walk.
Then I wasn't sure. I was like, I'm like, well, I don't know how long we'll be there. So let's go home and like, get a bag just in case. You never know at that point in pregnancy. So we went, and we didn't go to Stanford. There's 2 hospitals like in the same network. And we went to the one in Danville because I'm just like, if this is like super high, I don't want to, pop a blood vessel a 20-minute drive when there's a hospital right here. They brought us in.
They're wonderful.
They were wonderful. And they put me on blood pressure medication. They gave me an IV, and then they also prescribed me medication to keep taking. I don't remember what it was called now. That's so silly, but
maybe a beta blocker.
Something, yeah. It was some
ending in OL.
Yes, yeah, one of the alls. Yeah. So yeah, and then we went back, and we kind of knew at that point that it was preeclampsia, and then.
Well, the thing that night was that my question was for them is, are we going to be delivering the baby like today? Are we going to be able to go home? And they were not sure until they saw the results.
If the blood pressure went down.
If they were going to go down, then we could go back home until we see Jamie, our midwife. If not, then they would have to discuss the possibility of
having an induction.
Early.
Early.
Okay.
And luckily for us that day, the numbers went down, and so we were able to go home.
Yeah.
Okay. And then you followed up with your midwife?
Mm-hmm.
Okay.
Yeah. So we followed up with her, and I don't think she was happy about us being on this medication. I think she might have made a different choice as a provider. I was happy to be on the medication. Yeah. I felt like for my own self, the risk benefit made sense. Like,
nor was she happy that we had gone to this other hospital.
Yeah, I think she would prefer we had gone to Stanford because, she would have had more awareness of what was going on. But we talked about it, and she was just saying, you'll probably need to be induced, which was not what I wanted. And it was also very early. Like, we just kind of passed the 37-week mark. And I asked her, I'm like, can I stay pregnant if I keep on this medication and like I'm taking my blood pressure every day? And, if everything is okay, like, is it possible for us to stay pregnant, like at least till 38 weeks? Or, what's the possibility here? Like, do we have any leeway, or is this like really serious? And she said, she's like, if you wanted to, we can try it, but you have to come in for non-stress tests and take your blood pressure. And so that's what we did for about a week.
So from about 37 to 38 weeks, you were doing regular non-stress tests and blood pressure checks?
Every other day, basically. So every other day for a non-stress test, and like multiple times a day for the blood pressure. And it was good. Like, everything was great. We had no problems with the non-stress tests. And I'm very lucky. I work from home. I have a very flexible schedule. So that was great. I mean, we were in a good position. We had a lot of flexibility that made it easy to navigate all these appointments.
Were your protein counts going down, or were they going up? Or steady? Remember?
I think they were just kind of high. We never really said anything if they went down or up. But yeah, at 38 weeks, though, we went back in to see Jamie, and I was like, can we keep doing this? And she was like, I'm not super comfortable. Like, she's like, this is fine. There's nothing I'm worried about, but you have preeclampsia. We should probably we've got you to 38 weeks. That's great. But I think it's probably time to start seriously talking about an induction.
This was a Tuesday, I think.
Yeah.
Okay.
And then I was asking her, do you think we can go until Monday? Just because that was the last full week of my classes. Monday or Wednesday would have been the last day of the classes. So basically, that week would have been the end of the semester. So it wouldn't even be a full week. I was like, can we just go until Monday? And Jamie was like, it's up to you, but I would say no.
Yeah. So, and that was something that was really important to us, was that, she gave her perspective as the expert, as a provider, as a midwife. And I knew that, she wasn't coming to this from we have to manage you, like you have to do things my way or the highway, like you have to fit into this mold. Like she was very much willing to meet us where we were at.
Mm-hmm.
And she would have, if we wanted to, we could have kept going. But I trusted her. Like she created an environment where she'd always listened to us. She had always taken us seriously. Like we had this really beautiful, I think, relationship with her as our midwife. And when she said, I just don't feel like, she's like, you can, but I'm not sure. That was okay. I trust her judgment. She's never steered us wrong.
And she was right.
And she was right. No, I mean, I think I'm really glad that, we were induced. And I wasn't sure either. And that was the thing. If she'd said, we kind of went into that appointment thinking we want to know what she has to say. We're not sure. This is new. Everything seems like it's going fine, but we've crossed this 38-week mark. So we're early term, but still term. So I feel happy about that. And if that's as far as we go, that's as far as we go. And it kind of back to the point about, I wanted a low intervention birth, but not at my expense of my health, expense of anything else. I was like, you can also have a low intervention birth and be induced. So I was like, if that's going to happen, it's going to happen here. So let's go for it. So.
And I think she was right, because up until now, as far as I could see and you could see, you were looking for physical symptoms of preeclampsia, and they were not really there.
You still hadn't had any?
No, but I think that Wednesday or Thursday we went to the hospital.
Yeah, Wednesday or Thursday, but Wednesday I started to
on Thursday we took our last photos before we go to the hospital, and on the photos you could see see that the symptoms had very suddenly appeared out of nowhere.
And what were your symptoms, Sara?
I never had headaches or vision changes. I was very aware of that because I have migraines with aura. So I feel like I'm pretty sensitive to that. And that wasn't happening. I didn't have pitting edema necessarily, but my fingers and my feet were definitely puffy.
Your ankles.
Yeah, my ankles were puffy too. And I just thought, I was like, okay, we're on the road. And I know that's a normal thing that people experience in pregnancy, but for my pregnancy, I hadn't really experienced that type of swelling.
And it was sudden, and you already knew you had.
Yeah.
I mean, compared the photos of the day we went to the hospital to even 2-3 days before.
Yeah.
I mean, day and night.
I was also, in my face. So it was kind of like a little bit of the frog in the boiling water. And I was like, okay, this is a change, and it's subtle, but it's enough where we can see it. And yeah, that was the only physical symptom though I ever had preeclampsia. No headache, no vision changes, no spots. If I hadn't known, if I hadn't been testing, I would
blood pressure and your protein, you wouldn't have known.
I would have
you might have just said, "Oh, this is normal swelling."
Yeah, exactly. Because there's lots of things that can kind of it can be normal or it can be a symptom, and you have to have those other context clues to know when what is what. So, right.
Yeah. Okay. So, and at this point, you were 38 and a half weeks ish.
38. I think 38.3 was when we had.
And so you went to the hospital to be induced.
Yes.
Okay. And how did that process go?
I would say, the worst part about the induction for me was the IV. I really didn't want the IV. I don't care for it. I find it really uncomfortable. I'm not afraid of needles, but it's not pleasant to have the saline lock. And I kind of knew that was coming, but that was the worst part. We were given, cytotec, which was a weird kind of callback to pregnancy loss, but now it's the same medication for a very different purpose. So we started with cervical ripening, which was cytotec. And I would say the worst part, aside from that IV, was just that we went in overnight. And the way it works when you're in a hospital being induced is that, they keep coming every few hours. They're checking your blood pressure. They're giving you the cytotec because you have to take, small doses every few hours. And it was really hard for me to get rest. And I felt like I paid for that a little bit later the next day when I was actually having the baby. Another thing too I had done before I went in was I tried to calculate my own Bishop score based on what I knew from, because I had been open not to every cervical check under the sun, but I've been open to a cervical check during our last appointment just because I'm going to be induced. This is information I want to know. And I'm informed. I know the risk benefit here. And I think I'd prefer to have a check just because I would have a sense of what's going on. I felt again, calculating it yourself at home is a grain of salt, but I felt confident though, because I had a decent score that suggested that an induction might go well. I already had some cervical dilation, so yeah, it was fine. And then the next morning, I didn't really sleep super well. You didn't sleep super great either, but better than me.
You. Wow. Yeah, they would come in every
few
hours, and she had to wear. I mean, the saline solution was uncomfortable from the beginning to the end, but also you have to wear
the blood pressure,
the ultrasound, and
the monitor,
and the monitor would just keep coming off because you were trying to sleep, and so even the slightest movement on your part would dislodge it, and so it would just start beeping, and it was not a good night.
It wasn't restful, which is a real shame because you need your rest before, if you have the opportunity to rest before you give birth, it's so important. The next day, things seemed like they were going well. Jamie, my midwife, came to check on us, and
10 in the morning.
And then again, I was interested in this. I was check my cervix again, my request, and I was could you do a membrane sweep? Because I was just I would really like to avoid Pitocin. Mm-hmm. I would really like to have as low of intervention birth as possible. I'm already here. I'm already having this side attack to be induced. I'm can we? But it seems like things might be happening. Can we get the show on the road? Can we try it? And she was sure. And this is not something that she had pushed. It's not something she said you should do this. It was it was my wish to say let's see if this can maybe help. My body's on this road, it seems already. Mm-hmm. Maybe this is just one more push it needs. So she did a membrane sweep, and then I went into labor pretty shortly after. So
yeah,
that's amazing.
It was great. I feel we had a wonderful, wonderful induction experience, honestly.
And when did your doula arrive then?
When did she get there? I was kind of in labor land at that point.
Yeah, I think Jamie came around 10 o'clock. I think, right? It was about 10 in the morning?
Yeah.
Oh, sorry, Elaine. I was texting with her regularly about her progress. And as her labors became more, I think contractions became more and more intense. I was trying to help her various poses and breathing and poses. And at some point, I felt because you were in tremendous discomfort, I wasn't able to be the best support that I could. Well, let's retake that.
When did she come?
I think the doula came at my request. She was she was hands on deck. She was I'll come whenever you want. I think around 4 o'clock.
Okay.
So by 4 or 5, you were working pretty hard and you needed the doula there.
Yeah.
And I think about 4 or 5 o'clock. Yeah.
Yeah. How did you labor with the doula? What did you do?
Oh, wow. I mean, I was off the bed as much as possible. I didn't want to lay down. I was on my hands and knees a lot. I was in the shower. There was another thing that was really great about this hospital, this birth, what do they call it? It has a little tagline, a birth something.
The birthing spa.
Spa.
Yeah.
I mean, it does feel like a spa in many ways.
Yeah, it had a big tub. So I was in the tub.
Yeah.
I was in the shower, moving around. Just, there was a ball. I think I was on the ball for a while.
There's a little yard there that you can go walking in the yard. So we actually
walked there's a green space.
Yeah. She brought a TENS machine. So she's put the TENS machine on me. And I think it helped a bit. I think maybe if we had the forethought to either bring it with us or call her sooner, it might have been more helpful earlier in labor, but it was helpful. It really did, and yeah, so she came and, I think she was also she was tagging him out because he had been, doing counter pressure and kind of helping me through it. It just gave him a chance to breathe. And the thing that's really interesting is that, I know a lot of people go inside of themselves during labor. And I think I very much right around when she came was when I really started to go inside. It's I know she was there, but it's hard for me to always articulate what she was doing necessarily. Yeah. I felt I was kind of very much turned inward at that point.
Mm-hmm.
Yeah, but I mean,
and you were doing all this without Pitocin. So
all this,
gotten labor started with Cytotec and the membrane sweep. And then what happened next?
So labor's progressing, and at one point, I think I was really starting to throughout all of it. I mean, I was definitely a lot of discomfort, but I was breathing through it, and I felt okay. I felt like I had kind of a grip. And then, what time was it? Around 8?
8-ish.
8 o'clock. I was starting to feel out of control a little bit. feel very overwhelmed with like the surges of like the contractions. I was in the shower. I did not want to talk to anybody. Like the lights were out. I was very much like, just leave me alone, you know, and everyone was like protecting my space. And Siavash and Elaine were kind of, you know, as the nurses were coming in to check, they were just like, we're good. Like kind of helping me like maintain my like bathroom of solitude. But I was really starting to feel kind of hopeless at that point. I was just like, oh man, maybe I want an epidural.
Because your contractions were increasing in intensity, but there was no other movement.
No, and I was also experiencing some back labor at this point too, which is tough, you know. And again, this is kind of like where everything I knew and read and like thought about like pregnancy and birth, and it was starting to kind of just like slip away. And I was just like, I could have an epidural and lie down. We got the nitrous oxide, which was kind of funny because I was like one of the first things I ever did for EBP was like help us update our work on nitrous. So I had a nitrous and that was so helpful. But then I needed to kind of get away from the machine and go back to the bathroom. And then at that point I was like, you know what, I think I'm just done. I'm not going to hold myself like prisoner to what I thought I needed. I'm just like, I need the epidural. I just need it. I'm done.
This is around 9 o'clock. After 9 o'clock at night.
Yeah. And then my water broke. And then I was on 10 centimeters and it was time to have the baby. So I think that's something that happens to a lot of people during transition. And I think outside, I was very surprised by just how much knowing wasn't a preparation for feeling, which sounds really obvious, but you don't know what you don't know. You haven't felt what you haven't felt. So yeah. And then, I mean, I was ready to have this baby. I was starting to feel the ejection impulse. And, you know, I was like, I'm going to like have this baby on my hands and knees. I'm going to be upright. I'm going to like, you know, standing up. Like I was just like, so like thinking of all the postures I'll have this baby. And I was just like, I just want to lay down. I'm like, just put me in lithotomy. I don't care. Which is so, I thought it was really funny afterwards. Like,
you were exhausted.
I was tired. I think
you've been working really hard. And,
you didn't sleep the night before.
I was really tired, and that's what my body wanted, and it was great. Elaine got there was these bars, so she was able to help me kind of like position myself. Yeah, and then we had Ferdous. Like she came pretty quick.
It was a very quick.
I think I pushed like a couple of times.
Wow.
Yeah, the midwife was not there because the midwife was not expecting the baby to come that night.
Yeah, they're like first-time mom, Sara, in that room. Like, she won't be having the baby.
And the midwife finally came, and within, I think, 2 or 3 pushes, when the midwife came and the baby just came out.
Yeah, the first time I was experiencing like the ejection, like reflex. So like I could feel her moving down. I wasn't doing anything. I was just like, this is great. Like
she's coming out.
And I was like, I'm just going to like let it roll. And they're like, no, you can push. I'm like, I can't. And I was like, okay, I guess I'll do it. I think I pushed twice. Like it was very.
You pushed twice, and then they're like, you're not breathing, I think, correctly with it. So one of the nurses came and told you what to do exactly with breathing. And then the third time, the baby just came out.
Yeah, she was born. It was wonderful. I mean, again, like it was once my water broke and we were pushing. Like I know pushing can be uncomfortable for a lot of people. I think my experience with transition, like everything after that, I was like, it felt great. I felt really good. I felt in control again. I felt like I was like kind of back within myself, and it was good.
And no things changed though, right? At some point. So what happened next?
So Ferdous was born. She had a very, very short cord. Very short. I think less than 6 inches. It was really short. And so I couldn't even bring her up to my chest at first. Then we waited, and then once, her cord would stop pulsing and been like a couple of minutes, they were able to cut it and bring her up. And we were waiting for for the placenta to pass. And at this point, they said, do you want Pitocin? I was like, sure. Because I think, again, my risk benefit was like, this is fine for, this maybe what I wanted during labor, but I was like, I've given birth. This might be helpful for uterine contractions, getting the placenta out. So I was like, okay, sure. And we waited and waited, and I never felt another urge to push. Nothing else happened. And my placenta just was not budging. They came after some time. They tried traction to see if it would help encourage it to slip away. Skin to skin with Ferdous. It was wonderful. I was just so happy that I wasn't really even worrying about the placenta. And other than I wanted to see it. I very much wanted to see my placenta and like look at it in the dish, and because it's such an important, organ, and it's like it's done this amazing thing. And then they were like, it's probably time for us to remove the placenta, and like we can put you under because it might not be very comfortable. So I was like, okay. I felt fine with that. I was a little bit concerned at that point, I guess, when they were like, oh, like we need to maybe intervene here.
How long it had been since the placenta had not detached?
I think it had been about like 30 minutes. And by the time I was under, it was about 45 minutes. And like, I mean, there had been nothing, like no further contractions. Like it was just like holding on pretty tight. So yeah, you took Ferdous and.
Yeah. And then they just performed basically it was an operation. So
I wasn't there. So
yeah, there. Yeah. So I took Ferdous. I think
you're doing skin to skin with her.
I was doing skin with her. I think I was sitting one place. I think the doula, the lady was sitting between me and the bed, and she had, I think, one eye on me, one eye on bed. I was out of it a little bit because I had a migraine, but also I had the baby, so I was like, my focus was on the baby. At the same time, I was very anxious about what was happening. And I think the doula was just telling me, giving me updates on what was happening, but it was fairly short.
Mm-hmm.
I think maybe the whole thing took certainly less than an hour. Time at that point was quite, I had no sense of time, maybe half an hour.
Yeah.
45 minutes at most. Yeah.
Mm-hmm. And it turned out, I guess I have a heart-shaped uterus, so I don't have a full septum, but it's like partially have like a little septum. And what had happened, so the family practice physician came in to assist Jamie with this removal of the placenta. And also, Ferdous was very small when she was born. She was like 6 pounds, 3 ounces. The placenta was really small. And they said basically it was like tucked up in the lobe of your uterus. Like,
oh, wow.
So it was like kind of way up there. And that was the first time
Did you know you had that type of uterus? Yeah.
No, I guess it's not something that always comes up. Like even on an ultrasound, I was like, well, wouldn't they have caught this? And I guess it's something that you don't always see on an ultrasound either. So
the baby was on one lobe, and then it
was all tucked up in like the one side.
On the side, yeah.
So, but yeah, it came out, I think, fairly cleanly. I think they had to take out in pieces though. And when I woke up, I was like, well, where is it? And it was gone. But yeah, so I mean, I think it went as well as it could have gone.
And it's like one of those examples of an intervention that could be potentially life-saving. The fact that they were able to, put you under to remove the placenta safely.
Absolutely. Yeah. And I think too, because preeclampsia, a lot of times it's like a problem with how your placenta is connected to your uterus. So like it could have just been like really Velcroed in there.
So you didn't have any further complications, like no postpartum hemorrhage or anything like that? Because I know both preeclampsia and placental separation issues can cause that.
Yeah, no, I mean, they were very wary of that. I got a lot of fundal massage, just to help me bring it down. But there's no indication of a hemorrhage. Like once the placenta was out, things were, kind of nicely pressing down. One thing that kind of surprised me was that they didn't have a Jada device. It's like a inflatable balloon that you can put. It's a low-tech device that can, prevent hemorrhage. That I think is great. I know the hospital in Danville here has one. And I asked about it. I was like, well, do you guys have it? And they're like, oh, no, we just do other things if you have a hemorrhage. And I was like, oh, like, that's kind of a shame that you don't have that. But, there wasn't a need for it. They were able to bring me down, and things kind of returned to normal pretty quick. Once that was out of the woods, like I was cared for and like checked in on, but I didn't feel like all of a sudden I became this like high risk, like we have to be on top.
It's like they did everything, but there was no panic around it.
No. Yeah.
Yeah.
They were and I think because they were very calm and, never really treated me like a high risk case. Like I felt fine. Like I never felt afraid or anything. Like, yeah, I had preeclampsia, but I didn't have to wear a monitor the whole time I was laboring. Yeah, I need to be induced, but they were willing, I didn't have to have a whole induction.
They were flexible with which methods you got to use.
Yeah, I was able to labor in the bath, in the shower, move around. Like I was never kind of like those horror stories you hear of people who are like kept to the bed and, and
then you lose all control over your birth experience.
Yeah, I had a lot of autonomy, and I felt really respected the entire time.
Siavash, one of your, hopes for hiring a doula is that in case you needed additional advocacy, with discrimination, did any need come up for that at all?
Yes and no. I mean, the fact that they had to put her under to deliver the placenta, I think at that moment, I had like a lucid moment because I was also exhausted. I was like, okay, this is what I needed the doula for, just in case that something like this goes wrong, or this goes in a way that's unexpected. I mean, we initially hired the doula, I think, on my insistence, primarily for that reason, in a way to advocate, not necessarily for the birthing person here, but advocate for the advocate for the supporting partner. And in practice, primarily, I think the doula was able to, like Sara said, I think be a relief pitcher. Just give me a moment to rest, to get a break, to have a sip of water. I would say the anxiety that I had initially of discrimination did not really materialize in a way that would require the doula to help me advocate for her. There were two instances where I think that something relevant happened. One is that the nurses were phenomenal. They were wonderful. I mean, they were really, 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 really wonderful. There was one particular nurse there who, for reasons that I don't know, would not make eye contact. And when I would want to ask a question, like sometimes, they had a fridge there, but we had the colostrum stored.
Yeah,
so every now and then I would just go and get a vial of colostrum to feed Ferdous. And when I would go to the nurse's station during that specific person's shift, when I would ask them, they would not make eye contact with me. Or had one or two questions, they would usually look at somebody else and answer. And it felt somewhat discriminatory. I cannot say for sure. It felt like a bit of a racialized microaggression, for sure.
Right.
Well, that same nurse later came in and did some stuff with me, and it was very different with me and my mother. My mother had come and joined us at that point.
That's true.
You had gone to the house to like pick something up or do something. Like you were
sleep.
Oh yeah, we sent you home to sleep because you were so tired. And yeah, we had a very just night and day, very different encounter. So yeah.
And the other moment where I think I called on Elaine to help me was that after they delivered the placenta, she was in discomfort. She was in some pain, I would say even. And we were asking, I think you had at the moment asked for some sort of medication. For what you had asked for.
They're giving me Advil and Motrin. I was like, is there something that's stronger that's breastfeeding safe? Because I'm, I had a manual placental extraction. So someone's arm had been inside of my body. I had a 2nd degree tear, which I didn't feel at all when I was having the baby. I felt great when I was having her. And afterwards I was like, I'm in some pain. I had been catheterized. Mm-hmm. And I felt I was in a lot of discomfort. What I was being offered wasn't really helping. I was like, is there something that is breastfeeding safe that you can offer to me? Because this isn't even touching it.
What you offer to people who have had C-sections, for example.
Yeah, it was is there something? And
because you had just been in the operating room having this procedure done on your uterus, essentially. Yeah.
And I was just kind of blown off a little bit, and Elaine kind of strategized with you for us to find a way.
Yeah, so I spoke with her. By then, she had gone home. This is the day after.
Of course, yeah.
So I was speaking with her over the phone to try to strategize, to try to get better care for her at that moment. I think you had decided that you just want to, at that moment, that you were doing okay, and you just did not want to pursue this any further. And so we sort of dropped it. I think that was the one moment where the initial intention of hiring a doula sort of became, for me, became sort of necessary.
Yeah, to brainstorm.
Exactly.
Yeah.
Brainstorm advocacy.
Yeah, because she can't, she's not magic. She's not a superhero. She can't do everything for us, but she has so much wisdom from attending so many births and can help us find ways to ask or approach or reapproach a situation.
Yeah, ideas or options, things like that.
But if, for example, discrimination is a factor here, that they have a hard time hearing me out or listening to me or taking me seriously, then my ability to advocate for her, is reduced. And so at that moment, doula can help me brainstorm how to phrase things, how to say things, to sort of get them the best possible care for her.
Amazing. Yeah. I just love how, your doula did all the doula things, but also provided that peace of mind for you as well in that area. For sure. Before we go, is there anything else you would want to share for listeners who are entering birth or parenthood soon?
Hire a doula.
Yeah.
I don't know if I had $1 for every partner who said that.
Right. No. And I had preeclampsia, which is high risk. And I was still able to have a very as low of an intervention birth as was possible. Just because you have to be induced doesn't mean that everything flies out the window. You still have a say. There's courses you can take. And, I think we were very supported. We were never made to feel we need to panic and this is the world is ending. Because there's a lot of research has already been done. And there's lots of ways that we know to take care of people who are experiencing preeclampsia And, I think their calm let me be calm and let us, make sure that like we had the space to consider our options, and we had the space to, make sure that we were moving forward in a way that was both informed by the evidence, but also felt right, and that we felt totally confident. Like we weren't being pushed, we weren't being pressured, we weren't being rushed. Like, we felt really good. And I think that helped a lot. And yeah, I think it's exciting. Like being parents to a little person is really fun. They're so interesting. I think people always say, well, just wait. And then, like, there's lots of just waits. Like, just wait until they talk. Just wait until they start singing. There's lots of, I think, pleasure and joy, even in the parts that aren't super glamorous or exciting. And, it's hard. I'm not saying it's not hard, but, I think that, throughout all of it, there's been just a lot that's wonderful that we're grateful for. And in a way, I think too, like it kind of brought us full circle. Like it made me mourn the lost pregnancy a little bit more, considering like what that pregnancy could have become, having gone through it. But also, I kind of felt not grateful for having it happen. It was awful. I wish it hadn't, but I felt like it prepared me a lot for, in a way, labor. I think it gave me some knowledge and some insight that made the earlier stages of labor a lot more like manageable. So yeah, I'm just kind of rambling.
I would say for me, at some point her memory of that evening sort of became hazier and hazier and hazier, and then she didn't remember much really. But I was there. I think to this day, I cannot find the proper words right now, or really ever. I have never witnessed firsthand something as wonderful as what happened from the moment that she sort of went into contraction until the moment the fetus was born. I think I teach human evolution. I talk about, the fact that in the process of human evolution and primate evolution, there's nothing as important as the mother-infant bond. And again, very theoretical, very academic, and witnessing firsthand what was happening, what was unfolding before my very eyes, really made me understand, to the extent that any non-mother can, how that bond is formed. And it was just awesome in the very definition of the word.
Incredible. And with that, I thank you both for joining us and sharing your story. We really appreciate you both.
Of course. Thank you. Thanks for having us. This is really fun to talk about.
And for our listeners, I also want to encourage you to visit preeclampsia.org if you'd like to learn more about the symptoms, warning signs, treatment, prevention, all of those things. So we'll put that link in the show notes as well. Thanks, everyone, and I'll see you next week. Bye.